Has been a patient of Dr. Carmen's and was very highly recommended from her. My prior dentist basically had recommended that I needed a full restoration. My teeth were pretty badly damaged and worn from bite issues I've had over the years, grinding, and so they were to the point that the actual dentine was showing in the lower teeth. It was very discolored. The enamel was discolored from years of drinking coffee and etc. And I had a lot of chipping on my teeth. So overall, my teeth were in fairly bad shape. I had lost some teeth. I had some molars that were also in jeopardy of really needing to be removed for overall health and longevity. And my bite was such that it really, my upper teeth pretty much covered all of my lower teeth and went down into the gum area. So my smile was, really pretty minimal actually, and because of that type of bite.
Can you smile better now?
Yeah, my smile right now. Basically, Dr. Carmen recommended that we, raise my bite first of all to accommodate more space for the implants that I needed, because I really didn't have enough space with my current bite. And so...
and you got some implants before and they failed because no space.
I had some implants that actually failed, and
But they failed after the crown.
After the crown, I actually, the implants, well, one actually, after the crown was put on and everything, it became loose, and so really had to be redone. And
but that was an implant like placing in another office.
That was with another dentist, yes. So I was really shopping, if you will, for a dentist that could do examine me and give me recommendations on a full full restoration, and
full mouth.
Full mouth, and after a lot of consultation with Dr. Carmen, she explained to me the processes that she employs as a holistic dentist and the advantages of those. Also the advantages of the type of implants that she uses, and the crowns, and how there are not as many components to those as kind of a traditional crowns and implants and so forth, and the advantages of that, and the materials that are used and the laboratory that she uses, etc. So I would say that, first of all, Dr. Carmen was extremely detailed in the explanation she gave me. It was easy to understand, and really instilled a lot of confidence in me. It's obviously a major investment to do what I just had done. And I was also concerned about how long it would take, and basically we just finished, and so it's been just shy of probably around 11 months from start to finish. And during that time, I was never really in major discomfort, and if I was, I will say Dr. Carmen's the only dentist I've ever had that would text me regularly. And she's very attentive and concerned and sensitive to my needs. And the staff, all her staff, is extremely friendly, personable, knowledgeable, very accommodating. And really they go out of their way to make you feel comfortable during your visits and during various procedures. So I can't say enough good things about that.
Oh, thank you. And you feel better in general, like your health?
Well, I mean, yes. I mean, the process of raising my bite took probably 3 or 4 months, with some temporary type appliances that were put in. I never really had any discomfort. It was a very subtle approach, so I didn't personally have, and I have had in the past with other procedures, you know, a lot of pain and discomfort in my jaw, I didn't experience any of that.
That's good.
So it was a very subtle process, but the bite was raised, and I definitely, you know, it was, like I said, it's subtle, but you feel your jaw. My jaw felt more relaxed, and so oftentimes when I would wake up in the morning, because I have a tendency to grind my teeth and clench my teeth at night when I'm sleeping, that's disappeared.
Oh,
and
good.
So sometimes in the morning I would feel a little, kind of a headache, or, you know, a little discomfort from clenching and that sort of thing. Since the bite's been raised and the you know, the associated new teeth and crowns, I haven't noticed doing that at all.
Oh, that's good. So you're sleeping better.
Sleeping better.
Waking up without discomfort.
Waking up, and you know, the before and after pictures are quite evident. First of all, I have a much my smile is much more apparent. You can see both my upper and lower teeth now to some degree, and so that's certainly helped my appearance. And I've had a lot of compliments from people who really don't even know me, or people who have known me for years. They don't really know that I went through these procedures necessarily, and so they kind of say, "Wow, you look really good. You know, you're looking better, or whatever." And
younger.
And younger. I've had a number of my wife's friends who've known me for 20 plus years basically say, "Wow, Bob's really looking good. He really looks young." Colorado must be really agreeing with him. So they really don't know that I've had this done, but then other people, you know, they who are close friends, you know, I've told them that I was having, you know, some major work done, dental work done, and stuff like that. So, and then, you know, these teeth are so much, you know, obviously very white, and so that's added a huge improvement to my overall appearance.
So you chose a white color and you like it?
I do. I mean, it was kind of a leap because, I mean, it was just such a dramatic difference from my natural teeth that were so discolored. So it was like, you know, wow. And I have to say that was one concern I had that Dr. Carmen, you know, really made me feel comfortable with would be the final product of the crowns. I you know, certainly didn't want to have the look of, you know, artificial teeth, and so really the shape, you know, just the overall how they fit in my mouth, the dimensional aspects of the teeth. You know, I didn't want them to look, you know, like false teeth basically, or something artificial where people would kind of look at me, you know, and so as far as the coloration of them, I was also a little concerned that they would all of a sudden, I just look, you know, like I said, like an artificial teeth. But anyway, no, I've been very pleased with
the shape,
the color, everything. And the other concern I had was, you know, I guess how they would really fit together,
the bite,
and the bite, and would they feel natural, or would I, because basically I have, you know, crowns on all my teeth now and new implants. You know, would I have not so much discomfort, but would they just feel normal, so to speak? And it does take some adjustment, which is obviously, you know, natural. I mean, that's you know, and I would say after just a few visits, really, the adjustments were able to be made, and now they feel very natural.
Oh, good. And can you chew fine?
I can chew fine. Of course, I have I have new implants and molars where I didn't have any before. And because the bite has been so much improved, I can chew more comfortably and probably more effectively, if you will.
Yeah, for sure. You're doing better trituration.
Yeah. So, I mean, with the new teeth, I mean, my teeth were really ground down pretty severely. And so now if I'm eating, you know, something like meat or whatever that's more chewy, I've got sharper edges on my teeth, and, you know, so yeah, it's all working.
Better function. Better chewing function. Oh, that's good. Anything for your neck or your lower back or your back in general, like your spine, anything, any change?
Like I would say it's subtle. I mean, I feel good. I mean, and I felt more relaxed overall. So I think I think there has been some improvement there. I didn't really have major problems that I noticed really, but I do overall, since the whole thing's been completed, I would say that I feel more relaxed. And,
good. That's a good thing.
Yeah,
because it's good to have we call that the vertical dimension of occlusion. So when it's in the right position, it kind of makes all the system to feel better and work better.
Yeah.
So
I would say, you know, if you see before and after photographs, which Dr. Carmen's taken and shown, I mean, it's like dramatic as far as the difference between what I looked like before and what I look like now. And so if you just look at that, I mean, that alone is kind of indicative of how you feel, because your whole jaw and everything, your face is just more, it's better aligned. And so it takes a lot of the pressure off of the way, you know, I was before. And so it's visual. The visual is indicative of what I feel.
But it's really good that you like the appearance, but also you feel healthier. Because,
absolutely.
Yeah, that's kind of
well,
the main
psychologically,
thing.
it's a huge, you know, I mean, when you look at yourself in the mirror now, and
it helps your self-esteem
or in
as well.
photographs, you know, with a nice smile, and your face looks better and everything.
But also having a good function, that's the main goal. Not that you can chew better, you can enjoy your food, and you can, in addition, if your self-esteem is better because you can smile with more confidence.
Absolutely.
And people are giving you compliments. That's really good for your, like you say, your psychology, your emotions is really good. Self-esteem is really good to have.
Absolutely. And I mean, I didn't really have much of a smile before because of the way my jaws had compressed. And and I don't have a, you know, big wide smile, but it was definitely not much to it before. And now, I mean, my smile looks pretty much like it did when I was, say, in my teens.
Oh, good.
So, I mean, you know, again, after 40 plus years of damaging my teeth, I mean, in my bite and everything, which has always been an issue with me. So.
Oh, but that's good. It's a good result, and now you got your night guard, which is really important to use at night. And I'm happy to hear that. That's amazing, especially if you can sleep better and wake up with discomfort. You can chew better. You feel better, you look better when you look at yourself, you know, because one thing is that people tell you, which is great, but if you really see it, I think all of that is improvement of your quality of life.
Absolutely.
Because
absolutely.
Well, we have to eat every day. No, we eat every day, so chewing is important. That's the beginning of the digestion. Then the absorption of the nutrients. So all of that starts there. So having a good bite, it also stimulates the brain, so the cognitive function is improved as well.
Sure.
And so it's everything. So in an oral health, a lot of issues or really good things start. So I'm really happy for you. Thank you so much for giving us the testimonial. And then how do you smile?
All right.
That's good.
No, I would highly recommend this practice for just overall dentistry, but certainly, you know, this has been a significant, you know, process, significant amount of work and investment, and I would recommend it for anyone that needs that.
So it
level
has been
of work.
worth it for you.
Yeah.
Oh, good.
Absolutely.
Yeah. No. Thank you for being such a great patient, because that also and you healed really well. So you follow recommendations and everything was going really smooth. So it's also important when our patients follow recommendations, everything goes easier, like smoother.
Well, that's certainly, yeah. I mean, that's certainly.
You were really good with your Essex.
Yeah,
you were very punctual with your
appointments. You need to do what you're
appointments.
supposed to do if you want the results.
Yeah, it's a teamwork. So it was really good that you were really, compliant with your Essex. You were coming to the appointments. You had really good communication with us, because when our patients communicate with us, we know how to help them. We can figure things out. So thank you so much. Yeah, it has been a pleasure to be your provider.
Okay.
Yeah, thank you so much.
Thank you.